Hi, Dr. Choi. So I have to do this video today um, by myself because my family was being a little difficult and nobody wanted to volunteer to be my patient today. Um, so I'm just gonna try to talk through it for this week's video. Um, and I know my sound quality might be a little bad. I don't know how to fix that, but hopefully you can hear me okay. So for this week, you wanted us to go through the first 20 critical steps, basically, of the head-to-toe assessment. So first, we would start with the initial contact with the patient, introducing yourself, um, and then you would begin with the general appraisal, which is when upon first meeting the patient, you take note of the patient's physical, emotional, and mental characteristics. You assess for orientation, if the patient is of orientation among person, place, and date. Next, you would do some vital signs, so monitor the BP, the blood pressure, pulse, and respiration rate. You would take the pulse at the radial pulse and count for 30 seconds and multiply that by 2 to get their pulse rate, and then you would take the respirations immediately after that, so the patient doesn't know that you're counting respirations. And you would do this based off the patient's chest expansion just by looking at their chest expand. And you would also count for 30 seconds and multiply that by 2. The reason you would do this without letting them know is because if you let the patient know that you're counting them or monitoring their breathing, they may change their rate of respirations. So after the general appraisal and vital signs, you would examine the head and face. You would assess ears, eyes, nose, mouth, and throat. And you should document all of these findings thoroughly. To inspect the sclera and conjunctiva, you should depress the lower eyelids with your thumbs bilaterally. So I can't really do it on my face, but it'd be like this. And you would do it at the same time on both sides of the patient's face. You would assess for pupillary response. To do so, bring a pen light in from the temporal to the nasal aspect of the eye, and you test each eye individually. So start here and then the other side. Pupils should be round, equal, reactive to light and accommodation. And if they are all of those things, then you would document this as PERLA, so PERRLA. For the mouth and throat, you need a light source to inspect the mouth. Have the client open their mouth, have them protrude their tongue out like that, and have them say ah. And we have them say this so we can test or look to see if the uvula pronates when they say ah, if it moves upwards. And you should also have a tongue blade with you to depress the tongue to further inspect it. So after the head and face, you would go to examining the musculoskeletal system. We are testing for strength, range of motion, and coordination. You would have the client raise arms above their head and then have them clap their hands together. And after that, you should inspect the thorax. With the thorax, you are inspecting for shape, symmetry, skin color, respiratory patterns, and any accessory muscle use. You would palpate for masses, tenderness, crepitus, and fremitus. And when you're assessing the thorax, you want to start with the posterior thorax. And you would go posterior, lateral, anterior. Fremitus is testing for vibrations. So you're starting on the posterior thorax. You want to use the ulnar or palmar surfaces of your hands, and you're going to do this bilaterally. So you go down the patient's back like this, and every time you go down, you have the patient say 99. And you're feeling for the vibration. And as you go down the back, the vibration will diminish. After you tested for fremitus, you should auscultate for lung sounds. When you do this, you ask the client to take a deep breath in and out through their mouth each time the stethoscope is placed on their skin. You should be using the diaphragm of the stethoscope, not the bell, when you're testing for lung sounds. And you should move the stethoscope down and over, down and over. So what this means is on a patient's back, you start here, over, down, over, down, over, instead of going like in different directions. There is a systematic way you should follow. And you should be careful not to listen over the scapula or breast tissues when you're doing this. If you're on the back, you're avoiding the scapula. And you should be aware of the lung border, so you know where the apex and the base starts of the lungs. The apex of the lungs lies above the scapula, and the base of the lungs extends all the way down to vertebrae T10 up to T12. Make sure to auscultate the right lateral thorax, and we auscultate the right lateral thorax because with the right middle lobe, that's where the majority of the lobe's going to be, is on the lateral side. And it's important to do this because if somebody has right middle lobe pneumonia, that can be missed if you're only auscultating the posterior or anterior sides of their chest. So after we've done posterior, lateral, then we move to anterior. And you want to, again, start with palpating, avoiding breast tissue. And you're going to, again, palpate for fremitus. So doing the 99, have them say 99 every time you touch their skin with the ulnar surface of your hand. And then you should auscultate the anterior thorax, again, avoiding breast tissue. And again, you're still using the diaphragm. Then you would assess for jugular vein distension, or JVD. The patient should be asked to lie down on the bed at this point, and the head of the bed should be raised to 45 degrees. You want to turn the patient's head away from the side you want to examine. So if you're examining this side, have them turn their head this way. And having them turn their heads allows the veins to be more present, so you can see if there is JVD. So lastly, we want to look for the heart, or assess the heart. Now you can lower the head of the bed, make it flat, instruct the patient that they can breathe normally while you're auscultating for heart sounds. And for heart sounds, you can listen with both the diaphragm and the bell of the stethoscope. For the anterior side of the chest, you want to listen to all 5 areas, being the aortic area, pulmonic area, Erb's point, tricuspid area, and the mitral area. And lastly, you should place the bell of the stethoscope over the carotid artery when you're auscultating for the carotid artery, and you auscultate the carotid artery to listen for any bruits. And you should not palpate or auscultate them bilaterally. And when you are doing this, you should ask the patient to hold their breath in while you're auscultating for birds.